This is Akashvani Shillong, the Northeast News Bulletin, read by Arundhati Paul. The Indian men's national team stamped their authority and defeated Maldives 3-0 in a FIFA international friendly at the Jain Stadium in Shillong yesterday. This was Shillong's debut as a venue for international men's football, showcasing the strides for the state has taken in terms of infrastructure and the passionate fan support. Two headers from Rahul Bheke and Liston Kalako put the Blue Tigers in the driving seat. And talisman Sunil Chetri also scored the third goal and his 95th goal on his return to the national team from retirement. Manalo Marquez got his first win as coach of the men's national football team, and the team bagged their first win in 489 days. Present on the occasion were several dignitaries, including Meghalaya Minister for Sports and Affairs Minister Shakler Wajri, who greeted the players and match officials before the kick-off. The match proved to be a perfect preparation for India's 2027 AFC Asian Cup qualifier against Bangladesh on the 25th of this month, to be played at the same venue. Union Minister for Road Transport and Highways Nitin Gadkari yesterday announced that the government will soon introduce a new toll policy that will offer reasonable concessions to consumers. Speaking in the Rajya Sabha, Gadkari also highlighted massive infrastructure projects that are underway, particularly in Assam, where the government plans to invest 3 lakh crore rupees in road and bridge construction, including 4-lane and 6-lane highways and multiple bridges over the Brahmaputra River. He said that toll charges are necessary to fund India's expanding road infrastructure. The government is committed to making the system more consumer-friendly. He also addressed concerns over the placement of toll plazas, citing the 2008 National Highways fee rules, which prohibit toll plazas from being established within 60 kilometers on the same highway section and direction. In a major boost to the healthcare system, Mizoram Chief Minister Laldu Homa launched the Mizoram Universal Healthcare Scheme known as Mipui Healthcare at the Assembly House Annex building in Aizawl yesterday. The scheme is to be operational from April 1st this year. The Mipui Healthcare Scheme will offer an annual coverage of 5 lakh rupees per family and provide cashless medical treatment to citizens of different backgrounds, including government employees. The scheme will align with the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana and cover pre-existing conditions and hospitalization expenses. Beneficiaries will access to free treatment at state-run hospitals, primary healthcare centers and empaneled private hospitals within and outside the state. The Chief Minister hoped that the Mipui Healthcare Scheme would greatly be beneficial for the people of Mizoram. The Border Security Force yesterday apprehended 4 Bangladeshi nationals and 1 Indian in Meghalaya's southwest Garo Hills while they attempted to cross the international border. The operation was carried out by troops of the 50th Battalion BSF in coordination with the state police. Acting swiftly, the personnel intercepted a vehicle and detained the suspects. Following the arrest, the individuals and the seized vehicle were handed over to Mahendraganj police station for further legal action. The Ministry of Youth Affairs and Sports, Government of India in collaboration with Nehru Yuva Kendra Sanghatan yesterday organized a 2-day program on Viksit Bharat Youth Parliament District Nodal Round at Mairang Presbyterian Science College in Eastern West Khasi Hills District. This is part of an initiative to provide a platform for the youth to showcase their talents, encourage participation in public affairs, discuss policies beneficial to students, and deliberate on key national issues. A total of 150 students from various districts participated in the event. An 8-member national media team from New Delhi yesterday visited Ribhoi district in Meghalaya to assess the work being carried out under the government's 100-day intensive TB elimination campaign. The journalist team interacted with the Deputy Commissioner of Ribhoi district, State and District TB officer and traditional healers. The Deputy Commissioner said that Meghalaya has undertaken several initiatives to eliminate TB in the country by 2025. He informed that by engaging traditional healers and self-help groups, many patients who were earlier left out of the TB screening process are now getting screened and treated as well for the disease. Nearly 10% of the hamlets in the district have not reported even a single case of TB during the last 1 year. The national media team will be in Shillong for the next 2 days and will visit Ayushman Arogya Mandirs, primary health centers, state TB office and interact with the TB patients and TB champions. With that, we end the Northeast News Bulletin from the Akashvani Shillong. Have a nice day.